Invite Rachel Gold to come up and present. So Rachel's a clinical psychologist in private practice at Gold Psychology in Melbourne and food and weight psychology. So she supports the patients across Australia. She completed her doctorate in clinical psych in eating disorders and has over 12 years of experience working with eating disorders and clinical obesity. Dr. Gold has a special interest in supporting individuals with disordered eating in the context of medical weight management, including bariatric surgery. Come on up, Rach.
When I was doing this talk, I really love working with body image, and my instinct was to cram all of the knowledge I have about body image into a 20-minute presentation. And then I thought that might not be the right idea for this audience, but I'm happy to give you more information another time if you want it. My thoughts today was to use this as an opportunity to support my integrative health professionals with how to start these conversations about body image with their patients. So if I could just get a little show of hands, I've got two questions. One is, do you think body image has an important kind of role to play in people's satisfaction and outcomes post-surgery? Do you feel confident starting that conversation? Oh, yep, great. So there's certainly a subset of the group that will benefit from today, because what I'm going to do, and hopefully everybody, but what I'm hoping to do is give you a bit of an overview of what body image work is in this population, but also give you a lot of practical ways to start the conversation. But I just want to set the scene because I think we can get in our heads about how to have these conversations, so I just want it to be really useful. And because I know that some of you will diligently take notes and take photos, I've already uploaded the talk into my website and it has resources and everything there, so it's easily accessible. You can download it now if you want, but maybe wait till the end. And yeah, let's get started. And just to clarify, I've been moving towards doing a lot of online work, and I decided to have a separate stream to my business. So that's just what food and weight psychology is, because I do still see people presenting with a range of concerns, but predominantly people seeking medical weight loss interventions. So body image is sort of quite a broad concept, but it actually includes a number of different elements. And if we apply that to someone post-surgery, we might understand it as how they see their body. So how they might go, oh, Rachel, my stomach is still so big, and use really derogatory words to describe it. That might bring up all sorts of feelings about their body, like shame and sadness and anxiety. It's also our thoughts and beliefs, like, oh, I'm too fat, I'm too disgusting, I'm not good enough. That's part of body image. And, our behaviour in association with all of this, so we might think that seeking medical weight loss interventions is part of our body image. I'm not judging that, I'm just saying it could be part of that. And also functional. So a lot of patients are seeking surgery to help with chronic health issues, including pain. And I've worked with a lot of people who have found their pain actually hasn't been cured by surgery. So there can also be that sense of what your body can and can't do still, or what you have to live with long term. But just to be really clear, because there's so many different ways to think about body image, I'm talking primarily around body dissatisfaction and a little bit about overvaluation of weight and shape. And that's something that's drawn from the eating disorder literature. But body dissatisfaction is really, in our society, is seen as normative. I think some of the research is something like 80 to 90% of women experience body dissatisfaction. So it's probably likely that your patients have these concerns. And the idea is that body dissatisfaction is sort of more emotional, more fluctuating, whereas overvaluation of weight and shape is a more stable, enduring concern and a little bit more with clinical disorders. But I'm talking sort of in general to help as many people as possible. And that means that they might not need clinical treatment, but it's just to start to talk about this concern. Body dysmorphia is a separate thing again. It's actually a very specific clinical disorder, and it's usually quite delusional in terms of perception. So it's quite extreme, and we might see it in surgery when someone has lost vast amounts of weight, but they can't see it. And that's the one that shows up the most, or why is this actually important? Firstly, don't we all deserve to feel a bit better about our bodies? Like, if this is quite commonplace, I think just ethically it's worth planting seeds around having a more comfortable and peaceful relationship with our body in general, let alone whether we're seeking medical weight loss interventions. Secondly, the research says that it does affect outcomes post-surgery. The research isn't amazing, there's not a lot of it, and I'll put the references at the end, but if you don't have a good sense of, if you have body dissatisfaction, it sort of is shown to impact adherence to post-surgery health behaviour change, as well as contributing to disordered eating, quality of life measures, and even if someone's had good outcomes post-surgery, they might not feel good about those outcomes. So I think it's worth holding that in mind and why this is important. The interventions that I'm sort of alluding to are based on evidence-based practice in the eating disorder literature in particular. And I guess to put some context around how to use these questions, just pick one or two or make something that feels right to you. After asking the question, it's really important, you don't have to fix it for that patient, you just need to validate them. Some of us, it's like parenting. Sometimes we get focused on fixing, and actually it is literally holding space and validating, and that can help people start to process and think about themselves differently, and that's actually really quite powerful in itself. So please, if this is not something you're super comfortable with, don't feel like you have to have all the answers. It's just planting seeds and giving people some insight into what might help them, and sometimes that just sits there for a while, and that's okay. So you also can do a little bit of a motivational interviewing hack, which is to go in a really curious way, and if you don't feel like you can pull it off, that's fine, but to go, well, I guess, even if you do lose the weight, if you still feel this way, I'm just wondering if that doesn't fix it, sort of where that will leave you. And I think it's getting people to sort of start to realise, maybe this idea of what I'm trying to achieve isn't the full solution. So it's a way of just gently challenging. Sometimes people are quite focused on the solution being physical and about changing their appearance, as opposed to maybe something a little bit more internal and about the relationship with their body. And I guess the other bit is that a lot of I think this population might not necessarily understand the value of psychology, as I think everyone here would be on board with psychologists, but I think it's sometimes hard to sort of sell psychology or help patients understand what we can provide. So I think this is another opportunity to go, there's some really helpful ways to work with these concerns with a psychologist. It doesn't have to be for depression or anxiety. It can be just to help you have a better relationship with your body or food. So this is a way that I would sort of start it. I would sort of, just in general around body dissatisfaction, body image dissatisfaction, I just normalise it. I'd say, I guess everyone can read this and they'll be available afterwards, but it's trying to just gently follow up with saying this is quite a normal thing that people experience post-surgery. That gives you an opportunity to ask how they're feeling about their body post-surgery, and maybe even if there's just been some unexpected feelings or thoughts about their body post-surgery, and just getting the patient to consider if it's taking up a lot of mental space or energy or having a really big impact on their emotions. Now, this is from the eating disorder literature, but body checking is a significant contributing factor to body image concerns, which when you read it, you can see that we've got some challenges in this population, because a lot of these checking behaviours are actually crucial for good outcomes post-surgery. So we do need some sort of way of assessing change and someone's progress post-surgery. And things like, even if someone is having a helpful relationship with checking, their clothing size will likely change, and it can turn into something that's helpful and becoming more obsessive and more intrusive in terms of someone's sort of focus. So this is important because when body checking becomes really frequent, what happens is that the person starts to zoom in on these perceived imperfections. So think about, this is a silly example, but if you don't, I don't have any concerns about my nose, for instance, but if I was to look in the mirror and stare at my nose, I would start to lose the context of my whole face. And I promise you, if you try it, or something neutral for yourself, please don't give yourself a body image concern, but it's really interesting. I start staring at it, and then I start having this thought like, oh, it does look a bit weird. Because I'm losing that context, and that's what happens with our body. If we keep zooming in that, on that perceived flaw, we lose all this important context, and that's what happens to our clients. So I usually use that as an example with my clients. I call them clients, not patients, and they get a good giggle, but also it's a good way to demonstrate that examination sort of increases this distorted perspective. And it also means you become more sensitive to change. You know, God forbid if you get a bigger pore or something on your nose, and it sort of continues to focus on like success of someone's surgery or someone's well-being on shape and appearance, as opposed to sort of other outcomes and more broad outcomes. Body avoidance is very similar, but an opposite kind of behaviour. And you know, you're probably familiar with, you know, people feeling that they're not yet ready to show their body, or that they're not yet acceptable to be out in public. And often I find that a lot of patients would love to go swimming at the local pool, but that's something they're really anxious about. So I guess the issue with that is that it continues to reinforce this idea that their body is not acceptable still. So in the short term, and this is what I'd say to my clients, like, of course, like, avoiding something that makes you scared or feel uncomfortable makes sense. Like, it's a way of coping with your emotions. I totally get it. And at the same time, if you don't do the scary thing, you never get new information. So it really stops people from, you know, seeing themselves differently, having new experiences, and even doing things that make them feel more content in their body and seeing the value of, for instance, going swimming. I know a lot of my clients, when they do get there, it's a really lovely experience, and it is a way of being more in your body as opposed to objectifying yourself. So I have some more questions here to explore body checking and avoidance, and I will let you read them in your own time. I'd like to just briefly touch on social influences on body dissatisfaction. I think this is particularly hard because our patient group goes through rapid change, and even kind-hearted, good-meaning people can cause a lot of distress for the individual when there's this big focus on their appearance and weight loss. And I know that a lot of my clients tell me that it makes them more self-conscious and also question, well, what did they think before? So there's also a lot of, I'm not sure who's on the social media groups on Facebook and things like that, but I think there's a lot of value in those groups in terms of lived experience and support, but it's a hotbed of comparisons and feeling inadequate. You know, there's often that post, so-and-so, I've only lost this amount of weight in this amount of time. What's wrong with me? And that sort of ties in the social media pressures. So again, this is an important part of people's experience that can perpetuate their body dissatisfaction, and I would encourage you to ask about it. Another part of body image distress and dissatisfaction is self-talk, and it can be pretty harsh. So I think it can be useful to talk to your patients about their self-talk and their inner kind of dialogue. Some people haven't had any exposure to, this is sort of from cognitive behaviour therapy, but some people don't, they're quite therapy naive, and just saying, like, you know, we all often have a stream of consciousness, a way that we talk to ourselves, and I'm just wondering how you talk to yourself about your body. And just starting to kind of understand can be really helpful. And here's some more questions that you can ask to start the conversation. Again, you don't need to fix it or solve it. That's my job, that's my colleague's job. But it can be really nice for people to feel seen and understood, particularly when it's come from someone they didn't expect, like their doctor or dietitian. And this last concept I really like. So grief is basically the loss of something, and often we think of that as death of someone we love, but there's a concept called disenfranchised grief. It's when we lose something that's not acknowledged by society or isn't seen as appropriate to mourn. You might see that in something like fertility. You might see that when people lose a pet and they're expected to be over it in a shorter time frame. And I would say that body image grief is really important too, because it's quite validating. For some people, they don't realise that they have to come to terms with the fact that they need to let go of the fantasy of having the perfect body. And I see this in women over 60. Like, it doesn't, and I mean that with compassion, it's not necessarily something you just come to. This idea that if I just lose weight, if I just fix this part of my body, I will finally feel what I need to feel, or I finally feel like I can start my life or be enough. So talking to clients and patients kind of gently about this concept and saying, you know, do you find this relatable, can be helpful. I made a handout because that's something I enjoy doing, and you can download it on my website. It's just like one email, it's got the talk, it's got this, it's got an audio recording. I think I went a bit OTT, but this is my idea of fun. And I guess the antidote to body image grief is that you start to see your body as an ongoing relationship. It's not necessarily that you feel wonderful about your body every day or that you never have pain or distress. It's that, okay, I have a body, having surgery has been hard because I have loose skin or I have these scars, or I have to accept the fact that I will never look like this idolized version of myself or someone else I'm comparing to. But maybe there's a little bit more. And I think that's the blessing of grief. And I'm not saying that that's everyone's experience, but grief and trauma can lead to a recalibration or a silver lining around seeing what truly matters to you. You know, it can sometimes quiet the noise of all this perfection and expectations and go, you know, maybe there's things that I really want to focus on beyond my appearance, and it's okay that I would love that solution. And at the same time, I think I'd like to create a more meaningful relationship within my life in terms of my values and my goals and what's important to me. So again, these are some questions that you can help just open up the conversation about what creates a meaningful life for the person that you're dealing with, or supporting, I should say. And it's not saying that people should just jump to this. This is a slow process, it takes time, but I guess it's something that I imagine we all can relate to it to an extent. You know, if we really think about what we want to stand for, if we really think about how we want to be remembered when we're 80, and if we're lucky to get to that age, and to think about, you know, what do I want to look back on and be remembered as, or see in terms of what I stood for in my life. So, of course, physical health is an important aspect of surgery, and there's so many other aspects that are beneficial from surgery, but there will be a sense of maybe I didn't get every expectation that I wanted met, and that's both sad but also okay. So that's a bit of a heavy topic, but I think it's important. And my Food and Weight Psychology is the website with all the resources. I love a resource. I'll probably keep making resources. There's a part for allied, I think I've called it health professionals, but there's one for patients. Scroll down, there's a one for health professionals. If you want something, if you want to consult, if you find something interesting about this talk and want to ask me more questions, I love to chat. And I'm just really grateful to have the time to speak to you all about something that I'm so passionate about. So thank you.